People who live in glass houses shouldn't throw stones, but here is my best impression of Jordan Badfaith Peterson.
12 times the suicide rate post-gender-affirming surgery. The butchers and liars were murderously wrong. The CAS report indicated this. Canada and the US are still enabling this, putting children to the knife. Follow the science, gentlemen.
The suicide attempt rate among transgender people is 40%, meaning that 2 out of 5 attempt suicide at one point in their life. According to this tweet from Jordan Peterson, this number increases by a factor of 12 if they get surgery, meaning that 24 out of 5 transgender people that received gender-affirming care will attempt suicide. Wait a minute, that doesn't sound right. Let me quickly check if this is really what the source he linked in this tweet states.
Patients who had a history of gender affirmation surgery had a 12 times greater risk of suicide attempts versus patients who had no history of gender affirmation surgery.
If you only read this isolated sentence, you might really get the false impression that getting surgery caused the suicide rate to skyrocket. But this is once again the same issue that I talked about in the Ben Shapiro video. As this comparison was not comparing the rates before surgery to the rates after surgery, but merely comparing the post-surgery transgender suicide rates to the general population.
The results of this study indicate that patients who have undergone gender affirmation surgery are associated with significantly higher risks of suicide, self-harm, and PTSD compared to general population control groups.
This study did not look at any transgender people that haven't undergone gender affirmation surgery.
It may be worth examining if groups considering gender affirmation surgery who have not yet received the surgery share the same increased risk levels for suicidal actions and ideations.
So, no, this study does not prove that
Those who receive gender-affirming care have been revealed to be at 12 times the risk for subsequent suicide.
unless you are scientifically illiterate and don't even understand what the actual conclusion of this study was, which makes this tweet pretty ironic.
No one who is scientifically literate ever believed that gender-affirming care prevented suicide. Woke butchers promoted the idea. Cowards enabled them. Narcissist virtue signal as usual.
But we know that Jordan Bollocks Peterson self-identifies as a smart person. So the more logical explanation is that he deliberately lies about what this study actually shows, which makes this tweet pretty ironic.
The claim of reduction in suicide risk consequential to surgical/hormone intervention of gender dysphoria is an outright lie.
All the studies that actually compared the rates before surgery to the rates after surgery showed a drastic reduction in suicide rates, but he just flat out ignores all of them and instead relied on a study that only compared the rates after surgery to the general population. Something that is actually an outright lie is this statement.
12 times the suicide rate post-gender-affirming surgery. The butchers and liars were murderously wrong.
As it leaves out the key fact that they are 12 times higher than the general population and falsely implies that getting surgery increased the suicide rate. You can't just rely on one misinterpretation of one study to debunk the general consensus that's based on plenty studies that showed the complete opposite. This also applies when a new review comes out, like this here.
The CAS report indicated this.
The general consensus is that gender-affirming care drastically reduces the suicide rate.
We identified 55 studies that consist of primary research on this topic, of which 51, 93%, found that gender transition improves the overall well-being of transgender people, while 4, 7% report mixed or null findings. We found no studies concluding that gender transition causes overall harm. This search found a robust international consensus in the peer-reviewed literature that gender transition, including medical treatments such as hormone therapy and surgeries, improves the overall well-being of transgender individuals. The scholarly literature makes clear that gender transition is effective in treating gender dysphoria and can significantly improve the well-being of transgender individuals. Among the positive outcomes of gender transition and related medical treatments for transgender individuals are improved quality of life, greater relationship satisfaction, higher self-esteem and confidence, and reductions in anxiety, depression, suicidality, and substance use.
Considering that all the studies on this topic found that gender-affirming care has a positive impact, what does the CAS review state?
In summary, the evidence does not adequately support the claim that gender-affirming treatment reduces suicide risk.
That's weird. But how did they come to this conclusion?
Another recent paper, Ruska 2024, compared deaths by suicide in young people who had been seen in the Finnish National Gender Service with age-matched controls. The study also did not find a statistically significant link between hormone treatment and reduced risk of suicide.
Okay, let me check that.
Hazard ratios for suicide mortality were 3.2 in the group without medical gender reassignment and 0.8 in the group that had undergone medical gender reassignment.
There were 4 times as many suicides in the group that did not receive gender-affirming surgery, but as there were only 7 suicides in total, with 5 of those being from the group that did not have surgery yet, their results were not statistically significant. Combined with the wealth of other studies that showed a drastic decrease when they asked how often they contemplate suicide or how often they attempted it in the last year, I would still consider this study to be giving us a hint that this trend would hold up with a larger sample size as well.
A paper from the Belgium Gender Clinic reported 5 deaths by suicide among 177 adolescents clients. All 5 had commenced on masculinizing/feminizing hormones.
Let us ignore the typo in adolescents clients and instead focus on the claim that all 5 of those had received gender-affirming hormones.
This resulted in a sample of 177 participants who had at least one physical contact session with a psychologist at the pediatric clinic. Of all 177 participants, we are aware of 5 adolescents who committed suicide.
This claim is not supported by their source, as it doesn't mention anywhere if these 5 received hormones or not. All we actually know is that they had at least one contact session with a psychologist, and it is once again not a direct comparison between those that received hormones compared to those that didn't.
We observed 60% lower odds of depression and 73% lower odds of suicidality among youths who had initiated puberty blockers or gender-affirming hormones compared with youths who had not.
Studies that actually compare the rates of those that did receive gender-affirming hormones to those that didn't find a drastic decrease in suicidality, but it seems like the CAS review was not interested in those studies and instead just picked one where they misleadingly claimed that all 5 that died by suicide received hormones, even though their own source never even stated this.
The authors of a paper reporting on psychosocial outcomes of 315 young people treated with masculinizing/feminizing hormones stated that the most common adverse event was suicidal ideation and 2 participants died by suicide. Suicidality at baseline was one of the exclusion criteria for this study.
This also seems like more fear-mongering and less like an actually scientific look at their own source. The exclusion criteria was acute suicidality, meaning being visibly distraught and in danger of killing themselves at this very moment, but not merely having thoughts about dying by suicide.
The exclusion criteria included presence of serious psychiatric symptoms, e.g. active hallucinations and thought disorder, or appearing visibly distraught, e.g. suicidal, homicidal, and exhibiting violent behavior, at the time of consent or the baseline study evaluation.
The CAS review relied on this study as evidence that hormones do not help, but their own source actually reported the opposite.
During the study period, appearance congruence, positive effect, and life satisfaction increased, and depression and anxiety symptoms decreased. These observations align with other published reports that earlier access to gender-affirming medical care is associated with more positive psychosocial functioning.
The more
Follow the science.
the more I'm starting to think that the CAS review might be severely flawed.
A systematic review reported that in a majority of studies there was a reduction in suicidality following gender-affirming treatment. However, there were major methodological problems in most of the studies, with the biggest problem being a failure to adequately control for the presence of psychiatric comorbidity in treatment, such that no firm conclusions could be drawn.
Now we are getting somewhere. Here they cite a review that found that the majority of studies found a reduction in suicidality, but they did not consider the data robust enough. I will soon address this point, but first let me clarify why it was only the majority of studies and what the others reported.
One of the studies that showed an increase in suicidality did not compare suicidality outcomes before and after treatment, but rather to the general population.
I think we are all familiar with this one.
Persons with transsexualism after sex reassignment have considerably higher risks for mortality, suicidal behavior, and psychiatric morbidity than the general population.
This is the Swedish study that's probably one of the most misinterpreted studies, as transphobes like Ben Shapiro regularly cite it as evidence to falsely claim that surgery increases the suicide rate. The Jackson Review acknowledges that this one doesn't count, as it compared the rates after surgery to the general population, but a similar issue is also true for the other study that they mention.
This study examined mental health care and psychotropic medication utilization among transgender youth compared to their siblings without gender-related diagnoses. Transgender adolescents were more likely to have a mental health diagnosis, use more mental health care services, and be prescribed more psychotropic medications compared to siblings.
This study did not report that the suicide rates increased after initiating gender-affirming care, but it did report that the usage of psychotropic medications increased.
The military population included in this study is likely substantially different than previous research, which generally recruited youth from specialized TGD care clinics, which signals parental and family support. Military-connected children and youth also have free mental health care and psychiatric medications through the age of 23, which may lower barriers to continued engagement in treatment of mental health conditions after gender transition.
For all we know, increased usage of psychotropic medication in this study might just be caused by the fact that they got it for free to deal with the additional burden of coming out as transgender in a military family. But now, let me jump back to why the Cass Review did not care that all the other studies showed a significant reduction in suicidality.
However, there were major methodological problems in most of the studies, with the biggest problem being a failure to adequately control for the presence of psychiatric comorbidity and treatment, such that no firm conclusions could be drawn.
Let us look at one example for such a major problem that prevents us from drawing conclusions.
The majority of studies indicated a reduction in suicidality following gender-affirming treatment. However, the literature to date suffers from a lack of methodological rigor that increases the risk of type 1 error. There is a need for continued research in suicidality outcomes following gender-affirming treatment that adequately controls for the presence of psychiatric comorbidity and treatment, substance use, and other suicide risk-enhancing and reducing factors. Access to gender-affirming treatment may or may not also serve as a proxy to access to other medical treatments, such as treatment for substance use.
This sounds like they are reaching for reasons to dismiss it. It's much more likely that the gender-affirming care helped, rather than that they just randomly stopped taking drugs completely unrelated to getting surgery. All the evidence clearly points in one direction, but they don't consider that evidence to be good enough because those were not random double-blind studies with a huge sample size. But on the other hand, they don't seem to require any evidence to suggest psychotherapy instead.
The Association of the Scientific Medical Societies in Germany criticized the potentially harmful recommendation of psychotherapy for distress related to gender dysphoria, as no studies in the review showed a reduction in dysphoria through psychotherapy.
People like Jordan Peterson take the Cass Review as gospel, even though it goes against the medical consensus and has been heavily criticized by experts.
The Canadian Pediatric Society responded that current evidence shows puberty blockers to be safe when used appropriately, and they remain an option to be considered within a wider view of the patient's mental and psychosocial health. They stated there are significant limitations, biases, and inaccuracies within the review, and that the review has been noted to include incorrect citations of evidence and inaccurate, sometimes scientifically disproven speculations.
But the most thorough debunking has probably been done by Yale University. There are a lot of interesting chapters in Yale's response to the Cass Review, like how it misinterprets and misrepresents data, but I'm going to focus on the review's fixation of only considering high-quality evidence, meaning that Cass only wants to rely on randomized control trials with large sample sizes and long-term data. But keep in mind what I said earlier, that she only applies this standard to hormones and surgeries, but not to psychotherapy as an alternative.
In youth gender care, we have evidence that these medications effectively treat gender dysphoria, that young people continue these medications into adulthood, that their satisfaction with gender-affirming medical treatments is high, that their bone density recovers after puberty-pausing medications, and that their transgender identities persist. It is difficult to discern validity in the review's preoccupation with long-term data in youth gender care. It claims there is no long-term data, but does not define what it considers long-term to mean. It does not describe what long-term outcomes would satisfy its concerns, and does not consider evidence that has followed patients for over a decade. The review's desire to see only high-quality evidence dominate this field, however, is not realistic or appropriate because no other area of pediatrics is held to this standard. If high-quality evidence were a prerequisite for medical care, we would all be worse off. Moderate, low, and very low-quality evidence informs necessary high-value care at every stage of life. The authors found that the quality of evidence in 52 areas of medicine was often not high. These areas included procedures and treatments in fields as diverse as anesthesia, breast cancer, cystic fibrosis, pancreatic disease, blood cancers, multiple sclerosis, obstetrics, schizophrenia, and stroke, among many others. Far from evaluating the evidence in a neutral and scientifically valid manner, the review obscures key findings, misrepresents its own data, and is rife with misapplications of the scientific method. The review deeply considers the possibility of gender-affirming interventions being given to someone who is not transgender, but without reciprocal consideration for transgender youth who undergo permanent, distressing physical changes when they do not receive timely care.
So, all in all, no. I don't think that the CAS review should be taken as gospel, as it seems to be based more on supporting an ideological position rather than providing a scientifically accurate approach of transgender medical treatment.
12 times the suicide rate post-gender-affirming surgery. The butchers and liars were murderously wrong. The CAS report indicated this. Follow the science, gentlemen.
Transphobes outright ignore all the studies that show that surgery reduces the suicide risk, while misrepresenting those that they cherry-pick. Jordan Peterson falsely claimed that getting surgery increases the suicide rate by a factor of 12, but as we've seen, that's once again the same trick that Ben Shapiro pulled with the Swedish study.
The results should not be interpreted such as sex reassignment per se increases morbidity and mortality. Things might have been even worse without sex reassignment.
By just leaving out the key fact that this is compared to the general population and not compared to before surgery. Transphobes don't care about scientific facts. Never have, never will.